Okay, so Tracy's unfortunately defeated by the tech. Hopefully she can refresh and come back on and host. So I'll kick off today. So welcome everybody. This is a themed meeting around the reopening of releasing of restrictions. The meeting is being recorded. We will be sharing it afterwards. So if you've got any questions, please feel free to ask or put them in the chat as ever. So today on the agenda, we've got Sam Walters talking about reopening and what we're going to be able to do from the 17th of May next week. We've also got Lisa Chandler presenting about long COVID, and we know lots more about that than I think the last time we spoke about it. We have Amy Sunderland talking about Mental Health Awareness Week and Turning Point Talking Therapies and the support that is available for people, especially as we move forward. So I'll answer that question, but if I can just hand over to Sam, I think, to start us off. Welcome, Sam.
Hi, no problems. I think Tracy wanted to put this first slide up just to do an update on where vaccinations are. I don't know if somebody was going to lead on this, if it was Tracy or I think.
So I'm happy to talk to that. So we haven't got any data this week because this is a particular themed meeting about reopening and what comes next. But we just wanted to remind people about the vaccination programme. So in Wakefield, we vaccinated over 185,000 people, which is absolutely fantastic. And in the last week alone, almost 18,000 vaccinations. The work that's gone on has been phenomenal. It's really important that people come forward for their second jabs. So although a first jab does give protection, please do remind people to come forward for their second jabs. And just to let people know that if they have concerns, speak to their GP, ask questions here, and we'll try and get those answers out. But as we move through the cohorts of people who will be invited for vaccinations, so please keep reminding people to go forward because it really does protect everyone, not just them as well.
Okay,
Great, so over to Sam.
Thank you, Kerry. So you'll all be used to me by now from previous steps that we've gone through on the roadmap. So as you will be aware, Boris and co came out, I think it was on Monday this week, to announce the next stage of the roadmap, which is officially known as Step 3 for the purposes of the regulations. And we have been given the heads up that that is going to start on Monday, the 17th of May. So that's the Monday coming. So basically what I've done is just a brief summary. There is information on the .gov website, as I'm sure you're used to me saying already, but I've just done a bit of a summary as to what that means for us all. So basically, new lockdown rules will be introduced for England on May the 17th, allowing friends and families to meet indoors. So this is literally the next stage because, as we know, it's been in the garden. As I obviously don't need to tell you, we know that more than 150,000 people have died from COVID in the UK since the start of the pandemic, but we know that the coronavirus deaths has continued to fall since the start of January, and that is attributed very much to the vaccination programme and a lot of the measures that have been in place. So we know back in February, Boris Johnson revealed the roadmap out of the coronavirus restrictions, and we know that they were done in every 5-week stages, taking us up until June. So we've successfully worked through all of those stages, and as we know, we're at Step 3 because we've done the 5-week reviews and tests and we've met that criteria, and they're happy to now release the next stage. So basically, what can we do from May the 17th? So the general instruction from government is that you should continue to work from home if you can. And when travelling within the UK, you should aim to do so safely, and you should plan your journey in advance. We know that lots of the country's sectors will be able to reopen, those that have previously been closed, and they will include now indoor entertainment and attractions such as cinemas, theatres, concert halls, bowling alleys, casinos, amusement arcades, museums, children's indoor play areas, and lots of others actually, but they're just some to name a few. People will be able to attend indoor and outdoor events, including live performances, sporting events and business events, and attendance at these events will be capped according to the venue type, and attendees should follow COVID secure measures. So each of those premises will be open with a caveat that they've got a very comprehensive COVID-19 risk assessment in place. Indoor hospitality, so we know that restaurants, pubs, bars and cafes have been able to operate since step 2, so that was on the 12th of April on an outdoor capacity. This is now bringing that indoor, so indoor as well as outdoor. And organised indoor sport will also be able to take place. So whilst we've been able to go into gyms on a one-on-one basis, we can now open those up to gym classes. Again, that must be subject to reasonable measures and COVID-19 risk assessments. The other part for this is all holiday accommodation will open, including hotels and B&Bs, and these can be used for groups of up to 6 or 2 households. And as it's clarified there, each household can include a support bubble if eligible. So basically, so far, hotels and B&Bs have only been able to open for anybody who's been classed as a key worker or someone needing essential or emergency hotel provision. So gathering limits are going to be eased. So outdoor gatherings will be limited to 30 people. So whilst we've been able to sit outside in groups of 6, that's now going to be extended to 30 people. However, when you're meeting with anybody indoor in any capacity, it will be limited to 6 people or 2 households. And each household can include that support bubble. There are some exemptions for groups, and I can give you that information later. But the other bit that is being mentioned quite a lot, and you will have seen it on social media, is this new guidance on meeting friends and family. Now there is a link there, which is why it's blue, but it is emphasising personal responsibility, and this is sort of taken away from the government rules and put it back onto each of us as an individual. That I think you'll have heard it being called the hugging guidance, but there is now, instead of instructing you to stay 2 metres apart with anyone you don't live with, you'll be encouraged to exercise caution and consider guidance on risks associated with COVID-19. Basically, they are saying you can hug or have closer contact with people, but you've got to really think about, have they had both their vaccinations? You know, what is the risk? Where have you been? And to consider all that. Now, for Wakefield, whilst this is national guidance and it's been put out there and it has been said in the national conferences, we do have to put a little bit of caution to that statement, because we are still a higher level in Wakefield to many other places in the country. And I think what we've got to try and do is balance the messaging here, in that you know, we have got to proceed with a lot more caution than perhaps you might have in another part of the country. But however, it is up to people to take that responsibility for themselves. The rule of 6 is going to be expanded to indoor settings, so it does mean you'll be able to stay over or go and visit at someone else's house. And this is actually on the .gov website, but this is subject to each care home. But they have put the rules for care home residents visiting out and receiving visitors will change, allowing up to 5 named visitors to at any one time. Again, that is going to be subject to each of the care homes and what they've set as their limits, and there may be differences according to their COVID risk assessments, spacing and everything else. So I think you'll know a few weeks ago it was required that anybody going into a care home has to take an LFT or prove that they've had a lateral flow test prior to going in. I think that is going to continue. However, it will be subject, like I say, to each of the care homes. Okay, so funeral attendance. So we'll know, you know, this was very publicised during the funeral of Prince Philip, but they're now looking at funeral attendance, and actually to attend a funeral there will no longer be limits. So it won't be limited to 30 people, but it will be looked at in terms of what the capacity is of the venue, so whether that's the crematorium or a church, and that will need to be taken into consideration. However, there are going to be limits at weddings, wakes and other commemorative events, and that will be 30 people. So significant life events such as bar mitzvahs, christenings, they will also be able to take place with 30 people. Higher education students will be able to access in-person teaching, so we'll have a lot of the students going back. And support groups and parent and child group gathering will increase from 15 to 30 people. So if there's any indoor groups of that type, so support groups, mental health groups, family support groups, parent and toddler groups, those limits will increase from the 15 to 30 inside, again subject to COVID-19 risk assessments being in place and controls. You will know about this the discussion about the international travel, and that there is there's lots of conversations going around about the traffic light system. We know that there are a number of places that have been listed as a red, amber or green. There isn't a legal restriction now on, so previously in step 2 it was you must not travel. That is being lifted at step 3, and we know that there are the lists and the conditions. So what would happen if you go to a green country, what happens if you go to an amber, and what goes to a red. Again, the link is in there if you needed to look at that in any more detail. And then just looking at these indoor events, and again there's a lot more to this. It's looking at testing and who's attending, but indoor events will be allowed to have up to 50% capacity or up to 1,000 people, and outdoor seated events up to 25%. So this is looking at places like Wembley, starting with you know, the big football stadiums starting to return to having some sort of capacity in those large arenas. Thank you. Is there any questions? So yes, I can see just in the chat there now singing is one thing. So just to put everybody in the picture, the information has come out from government on Monday. I'm attending a training session with government this afternoon for them to update us. We are still waiting for the regulations. We have got the regulations, because there still are the same regulations that were produced at the start of the roadmap, but quite often they are amended. Now, the information that's in the regulations still stands. And singing is one of the things. Singing and dancing is really a step 4, but there will be some allowances depending on the setting. So it's all going to depend on the setting there, Paul, I think, just to answer that question. And we are waiting for the regulations to be updated. So while stuff has come out and it's there as guidance, the actual regulations themselves, we're looking at what was produced before, but there's an indication we may get an update on that. And then I think Andrew's put some information there about our particular funerals in Wakefield and our limits that we've got around Wakefield Crematorium and others. Okay.
There was a question further up about the ADDI. Are there any limits to how many people you can have indoors at a cafe?
So again, it's going to be tables of 6 or 2 households, support bubbles. It's the same. It's the same. Anything inside, any capacity inside that is either your home or a cafe or hospitality business or something that you're entering in that capacity, other than being a support group and having one of the exemptions. So some of the exemptions allow for bigger groups, but if you fall out of those exemptions, then a cafe you would have to still sit in a table of 6 or 2 households, which can be unlimited numbers, which you can imagine how many people tell us that they're all from the same family when we've got tables of 20, but that is the rule. Any other questions?
Hi Sam, it's Tracy. I'm sorry, my internet connection is on and off. Apparently one of our masts has been hit by lightning, so it's a poor connection. But I did see earlier on that you said 50% of normal capacity in your slide for indoor things. So does that count for the cafe as well, that there would only be allowed 50%? No, right.
No,
thank you.
No. So we'd have to look at the venue, but this is more about your larger events that are starting to happen. So it's more about your football games, your rugby games, and any Olympic, anything like that. That's those sorts of capacities for stadiums. It is, you have to do a COVID risk assessment on your size of your building, looking at ventilation. There's lots and lots of things that you have to consider. They are on the Health and Safety Executive website on how to conduct a COVID-19 risk assessment. So you can have a look on there, and that does guide you through the considerations that you need to have, and on spacing as well.
Thank you for that clarification. And Bob put something in the chat about, I've heard people referring to a metre plus social distancing, and I think some people do get mixed up with, is it 1 metre or 2 metres plus? 1 metre plus or 2 metres?
So So it's 2 meters unless you've got mitigating circumstances. So if you've got mitigation, that would include screens, face coverings. It's all dependent on your setting and on the arrangements, and you're back to back. There's lots of other considerations there. If you are less than a meter, obviously the closer you are, there is more exposure risk. However, there are things that we call, like I say, mitigating allowances. So that would allow people to be closer together because you've got natural barriers between them.
Yeah, and that's not changed really then, has it?
No, that still remains the same. Yeah. That's still going right up until June, and then we're waiting to hear exactly what, because as it would appear at the moment, there is suggestion that all social distancing, a question regarding face coverings, we're not near there yet. I mean, obviously there's another 5 weeks from Monday, but that is the suggestion at the moment, is that they are going to be looked at and to be reconsidered as to whether there's going to be any social distancing at all required after that date. But we've got this next 5 weeks just to check we don't get any variants of concern, and just to have a look at where our rates are and everything else. We'll follow that closely.
Thank you very much, Sam. Does anybody else have any questions they'd like to ask? You can turn yourselves off mute to ask, put your video on if you choose, or pop it in the chat. No, I don't think so. So you've been very comprehensive. I'm sorry that I missed part of it. Thank you, Sam. And I think we've answered that one, haven't we? Or have we, about the Knit and Natter meeting indoors? 6 people attending.
Yeah, so it'll apply to your larger groups, that your groups that you've got in there. So as long as there's a COVID risk assessment in place, that's gone up now, so that those groups can meet inside.
Yeah,
that will be fine.
That's lovely. Thank you ever so much. So now I'd like to welcome Lisa Chandler, our public health principal, who is going to talk to us about long COVID. Over to you, Lisa.
Thank you. And before we start, I've just got to say the biggest excitement in our house is getting back to watch rugby. So that's half standing, half sitting, and we're all outside in the rain, pretty much all outside in the rain. So that's sort of the biggest thing for us at the minute, is that we're really excited about going back to rugby. Batley, I'm afraid, not a Wakefield or Ponty team. Okay. Okay, so just as a way of introduction, my name's Lisa Chandler. I'm public health principal working with Tracy and Kerry. My background is as a respiratory nurse specialist, so I tend to get sort of drawn into work around anything that's respiratory connected, with the local CCG and health as well. So just to talk to you today about where we're going and how understanding is developing around long COVID. So this is just the plan. Obviously, we can answer any questions, or if I don't know an answer, I'll go back and try and find out an answer for you. But it's just to go through sort of, what it is, what the symptoms are, who it happens to, or how often it happens to, and when you need to go to the GP, the sort of treatments, and what we've got in place now in Wakefield that we haven't had before. So just to start off with, I think it's really important to get an understanding of what we're talking about. So long COVID was, people who were experiencing it started talking about it really very quickly after the first sort of lockdown, the first lot of infections. It was clear that you didn't have to go into hospital to experience it. It was clear that it was happening to all sorts of people, even those who hadn't had a really severe infection. In fact, people who'd had a mild infection were experiencing ongoing symptoms. And then you had, very fit 30, 40-year-olds who were talking about having these ongoing symptoms. So long COVID is a term that really is sort of has been coined by the public, if you like. There then becomes an issue about how do we define that as professionals and as for medics and people, or people who are looking at how we design services and stuff. So there's some new definitions developed by NHS England and NICE, so you may or may not have heard of, but they've developed these definitions. And for the rest of this, I'm going to talk about long COVID, but just that. But long COVID does cover these ongoing symptoms from 4 weeks up to 12 weeks, and then it also covers anyone from 12 weeks on. But in sort of professional circles, when they're looking at patients and designing services and things, they do split it out to ongoing symptoms and post-COVID symptoms. And that isn't to try and exclude people, the public, from those conversations. It's just so that they can be very clear about what and who they're talking about, because things will change depending on where you fit in. So I hope that's okay and not too woolly or confusing, because I get confused myself sometimes. So I'm sure you've all seen sort of similar things to this already about what sort of symptoms you have. And one of the big things with long COVID is that it's not unusual for people to go on and have sort of illnesses that go on after a virus. So if you have a virus, it's not unusual or unheard of, I should say, for people who've had a virus to then go on to have some other ongoing problems. It just doesn't usually happen as often as it's happening with COVID-19. So we're seeing a lot more of these ongoing symptoms, and the things that people are reporting are things like brain fog, where they can't think, they can think straight after they've had a COVID infection, anxiety, depression, and a lot of confusion in older people. But the three symptoms that are really coming out at the front are an ongoing cough, people being short of breath, which you might think isn't too surprising, as this is a disease that does attack your lungs as one of its part of its initial illness. But the shortness of breath is even for those people who haven't had a particularly bad episode and the breathing wasn't affected when they had the COVID infection. And then the biggie is this fatigue. And for some people, it's you feel a bit tired after you've had a virus and you feel a bit unwell. For others, it is you just can't get out of bed. And we've got a couple of people in Wakefield who are experiencing that fatigue to this level. So that overwhelming tiredness is being reported quite often. Then you also get the more confusing things like joint pains and muscle pains, muscle weakness, dizziness, ringing in your ears, sore throats, the loss of smell and taste can go on for a long time. The reassuring thing is that a lot of this will go. It'll go by 12 weeks and you'll start to feel better. And most of this is then about self-care and self-management of these symptoms. But for some people, these go on and they are very severe. The other thing to say is that, so I know before we were talking about deaths, and we often look at this in terms of deaths, but this ongoing COVID, this long COVID, also affects children. So it's rare and it's not happening very often, but there are children now who are experiencing this severe fatigue. And as we look to us all being vaccinated, we need to remember that it's not just about hospitalization and death. It is also about what those ongoing effects from having a COVID infection might be. But again, I will just say they're really rare, but just to keep that in our minds, that it's not just about dying or being put in hospital. It's also about that risk of getting long COVID. So how often does it happen? Well, there's been lots of calculations that have gone on. The Office of National Statistics is collecting a survey, looking at the numbers of people who report on these ongoing symptoms. And just at the side there, this little graph, and it says persistent symptoms at 12 weeks. So you can see there the groups most likely to have ongoing symptoms are your 25 to 34, 35 to 49. If you extend that and look further at your over 50s, they've got a similar sort of level of ongoing symptoms, persistent symptoms at 12 weeks, around 16%, and the over 70s, about 11% of people will have these ongoing symptoms at 12 weeks. In Wakefield, we did some calculations, and we think, well, this is at the beginning of March, but infection rates have slowed down, even though they're not great still. But we think there's around about 2,300 to probably 2,500 people who are still experiencing symptoms 12 weeks plus. Now, some of these have come forward, and we're starting to see people, or we have been seeing people at Mid Yorkshire in the rehabilitation services and other services to help them with the symptoms. A lot of people aren't coming forward, and what we've seen in other areas like Leeds, for example, is it tends to be your very fit women, 25 to 40 years old, who probably run marathons or regularly gone to the gym, who are coming forward and saying, look, I can't get back to what I was doing before, I've got a problem. we know they're not the only people. There will be more people out there, and it's really about finding them and saying, you know, this isn't normal, it isn't okay, you need to go and see somebody to see what we can do to help you. We also know that some people go on to have sort of very severe problems, and at the minute we think probably around 450, 60 to what, just over 1,000 people might need to go on to to specialist care and specialist support through what we call in our post-COVID assessment clinic. And I'll tell you about that in a minute. Other thing just to think about is that those financial impacts and the wider impacts altogether. So if you can't get out of bed, you can't do your job. And I will admit to some personal experience. I've got a niece who had a very mild infection with COVID. No one was very worried about her, because she's in her 30s and she was fine. She works in a shop in Dewsbury, and she can't go back to work because she's worn out all the time. So we've done lots of investigations, but nothing's showing up, and it is just this fatigue. So it will affect people. We know that we need to do more work with employers, and we also know that people are describing not being believed when they say they've got this terrible tiredness, or that the condition isn't being understood by employers. So one of the things here is that one day you can be fine and you can be out and up and doing all your normal stuff, and then the next day you're hit with symptoms, and they're not always the same symptoms as well. So it does get this very sort of fluid change in picture all the time, which I think people perhaps again don't necessarily understand, and then you start getting people thinking it's in your head. And so we really do need to make sure that we believe people and we take it seriously. Also unpaid care for children or relatives and other things that you're just expected to do, and one of the things is that we've seen is particularly with women on this, and women are expected to look after the family and to cook the meals and to do all the things they're expected to do, and they haven't been able to do those things, and that's caused some challenges in family relationships as well, as women aren't able to fulfill their roles in something a bit woolly that people don't really understand. So I just wanted to just mention this in children. So if you look at the impact on children, and we look at hospitalizations, they've been very small. If you look at the risk of having a severe problem with this, it's also extremely poor. So one of the things I do want to do is to make sure that we get this in proportion. So if you look at something like asthma in children, they're at much greater risk from asthma, and they're much greater risk of becoming unwell and something going wrong if they had asthma rather than have had a COVID-19 infection. So just to use that as a sort of an example of, not to get, we don't want to get too bogged down with this as a risk, but just to have it in our minds that it is there and possible. One of the things I just did want to flag up was the serious side effects. So when we want to go to the GP urgently, so they think that there's something to do with inflammation after the virus, and maybe something to do with your immune response as your body's trying to fight the virus. And what we can see, even a couple of weeks or so after that initial infection, or a few weeks after that initial infection, people can start to they can have some serious side effects. So we'll get, I'm sure you've heard of PTSD. It's a lot more is known about in people now. The most common people to get this are people who've been on the intensive care and who've had a tube down and things like that, not been able to breathe, or had the masks on, which blow air into your face, because they can make you feel very scared. But it's not just those people. Other people are having nightmares and really exhibiting some really sort of severe mental health problems. The lung inflammation and scarring, it might, people might end up using oxygen at home because of that. There's also numbness, and there's a condition called Guillain-Barré syndrome, which you can get after a virus, but it's where your immune system starts to attack the body. So if you start to get really lots of rashes and things like that, and the joint pain and those things, they really do need to be checked out by a doctor. So it's not, we don't want people to just think, oh, this is because I've had COVID, and not come forward. If you're experiencing any chest pains or racing heart rates or headaches, anything, or feeling unwell in general, the best thing to do is talk to somebody about it. See your GP if at all possible, but make sure that we do exclude that anything serious is going on first, and not just sort of bat it off as being long COVID. what we need to do next, I suppose, is start to think about treatments. And really what we're doing at the moment, which is nationally, not just in Wakefield, but nationally, what's happening at the moment is there's loads of research going on, but the main way to treat any of the symptoms of long COVID is based on the symptoms. So if you've got fatigue, severe, they'll investigate it first, make sure that it's nothing else that we need to be worried about, and then you would be put onto a program of fatigue management. If you have, if you have a heart problem as because of this, your symptom will be managed from a heart perspective. So it's very much about going to manage each of these things based on that symptom rather than anything magical or different that we're doing yet. As I said before, there are other viruses, or people do have problems after viral infections, and there are some some treatments are set up for that, and we're trying to find out if they also work for long COVID. The first place to go for anybody who thinks they might be having symptoms of long COVID or might be experiencing long COVID is your COVID recovery. And I'm not a great fan of online usually, I'll be honest with you, but because this is a brand new condition, a brand new disease, people aren't going to be experts in it. So what I would say is go to your COVID recovery, because that's where all the expert advice is at the moment. So there's a little picture of it to the side there. Also see your GP, and I know IAPT's on the call in a minute, but the other thing to also will be considered as part of that early work that the GP is going to try and do to support you is, as well as those investigations, they're also going to recommend that you see people like Live Well, Wakefield and the IAPT service if that's appropriate to you. So just sort of looking as an overview of all the treatments that we've got. So as I just said, they're based on symptoms that you're experiencing at the time. The most important thing, and I know, Sam's just said again, we're not out of the woods yet. The most important thing is to avoid an infection. And if you haven't had COVID, you can't get long COVID. And so that is, that's the thing really. It's not just about death, as I said before, not just about death and being in hospital. It's about those things that come later. The other thing that they've noticed particularly is that there's a lot of healthcare professionals got this, and there's a lot of women got this, and there's a lot of people who've been very fit in the past got this, and they think that part of that is that people aren't resting. They're trying to get back to work. They're trying to get back to all the things they were doing, or if they haven't had if they've had a mild infection, they're thinking they should just get on and do what they were always doing. And that pushing yourself, that not taking time to rest, not taking time to recover, is actually seen as one of the biggest risk factors to get this. So again, that message is, if you have got COVID, even a mild infection, not so easy if you don't know you've got it, but even a mild infection, please rest and take time to recuperate. Don't just try and get straight back where you were before, because that's likely to make things worse. Self-care, and I was going to just move that last one, the app-based supports, up to the first thing that you do. So anybody who's got any concerns that they might have symptoms, go there first. That's your first point of call. It'll give you advice, tell you about what's available, tell you about what to do, and that's really important. If you can't get online, obviously that's an issue, but online, that should be your first point of call. We know that supporting people to get the right amount of sleep, to manage any anxiety and depression, to think about what they're eating and drinking, to manage their weight and not smoke, and we know these all are effective. And as I said before, we haven't got a magic pill or a magic anything, but we do know these things work. The work that's been done so far, particularly with patient groups, tells us that this works. So the earlier you access that, the better, really. So just to really push on that. If after 12 weeks you're not improving, then the GP might make some additional referrals into somewhere like the community therapy services. It's My Therapy. They can do rehabilitation, fatigue management, occupational health, occupational therapy type work, also things around your speech and eating and swallowing, all those sorts of things. They might refer you into something like that. If you've got any urgent concerns, blood tests have been done, all that stuff's been done, they'll refer you into a doctor, and that could be a doctor who deals with your kidneys or your brain or your heart. It's not necessarily going to be someone who who looks after respiratory disease in your lungs. So they'll send you where you need to go. And anyone not too complicated, nothing sort of, there's nothing complicated going on, they can do that. They can do that anyway. But for those people who look as if they're going to need some much more specialist support and rehabilitation, we've got a new service set up, which is called Post-COVID Assessment Service. And this is a very busy and very, very complicated slide, but this is just meant to say that once the GP has done all the things that they need to do, they've tried to manage anything that they can up to those, from those 4 weeks to 12 weeks sooner if things are going wrong and they need to sort it out. But from there, if you're still not right, or if they've still got some real concerns, they will send you into that little red box there, which is the Post-COVID Assessment Service, who can then, sorry, there's a line missing there, Tracy, for some reason. They can then refer you on to where you need to be from that point onwards. So we've got a clinical coordinator who's actually a physiotherapist. So all the referrals go into one place. We've got a physiotherapist, someone who deals with mental health, and someone who deals with occupational health therapy, who look at all the referrals that come in, try and then make sure they get to the right place from there on. So that's there, and the GPs have started sending people, but we need to find the people like who aren't going to their GP and who aren't getting the help in the first place. So just to say that the important points to take away for me is anybody can get this. It's an all age thing. It's not really common, so it's not something to scare people about, but it's there. And if you have symptoms, you need to get treatment and you need to speak to somebody.
Thank you very much, Lisa. Thank you. Does anybody have any questions for Lisa? I think you've given a very comprehensive overview of long COVID there. Thank you. And the key message to just get people to visit their GP or seek help if they think that they might be suffering from it. So that's great. Thank you. And that leads on really nicely, actually, because one of the things I think you mentioned was about IAPT services. And we've got Amy Sunderland, who's going to explain to you all about talking therapies and what that's all about. So over to you, Amy. Thank you.
Brill, thanks Tracy. So, as Tracy mentioned, I'm Amy. I'm the community team leader at Turning Point Talking Therapies. I have spoken to community champions before about our service and what we do. So this is a bit of a recap of some of the things we can support people with and how people can access our treatment. And I'm also going to talk a little bit about our groups and workshops, because we have got some new ones running at the moment. So if yourselves or anyone that you support can benefit from them, we just want to let you know what's available. So we are the Talking Therapist service for anyone in Wakefield who is over 16 and registered with a Wakefield GP. We're a self-referral service, so people can give us a call or go online to refer themselves. They don't need to go to their GP first, but we find that many people find out about us through their GP, and that's how they learn about us. So if you do know anyone who's struggling with low-level common mental health problems such as anxiety, low mood, depression, worry, panic, etc., those are things that we can help people with. And the way that we do that is by one-to-one therapy, through group therapy, through online therapy, or through our workshops as well, to help people manage those low-level problems before they escalate. We're open 7 days a week, which includes weekends and evenings. There is a slide coming up with our opening times. We're here to be accessible so that people can access our service. So we go to the next slide, which talks a little bit about IAPT, a reminder that IAPT stands for Improving Access to Psychological Therapies. So it's completely free for anyone to access, because we are funded by the NHS and we work in partnership with Wakefield CCG. The only sort of difference between IAPT services and other services is that we provide evidence-based treatments for people with depression and anxiety disorders by an appropriately trained and supervised workforce and through routine outcome monitoring. So we do lots of questionnaires just to check that our interventions are working, and so we can monitor people's recovery and their journey. Just a few examples of some of the things that we can help with. So any request for counselling or therapy, anyone who's feeling low, down, snappy, irritable, stressed, worried. I've mentioned anyone suffering from panic attacks, anyone who's struggling with their sleep, problems with mood. And we also treat a range of phobias and trauma, and any unwanted thoughts. There are some things that we can't treat. So for example, if someone's got a severe mental health diagnosis already, then that's something that we wouldn't be able to treat. And as I mentioned, we are a 16+ service. So it's anyone who's over 16 registered with a Wakefield GP can access our service. If you are unsure if we'd be able to help you or your clients, then please do just give us a call. Our contact details are at the end of this slide, or you can go online or drop us an email to ask us. If I can have the next slide, there's a bit of information about how you can access our service. So at the minute, we are just providing a telephone and video service. We are looking at ways to go back to face-to-face working. We've been advised that the IAPT guidance will be a sort of blended model for the future, with those telephone and video appointments and face-to-face appointments being offered, whatever the client's preference is. So the way that it works, if you ring up or you complete a referral online, you'll then be called back to complete an assessment over the phone, which takes about 40 minutes, where you'll be told which treatment would be best for you and what you'd be suitable for. If we're not able to support you, we will signpost to other services, and we are able to refer on with client's consent as well. We're not just going to turn someone away and say, no, we can't help you. We will find the service that is right for you. If you are suitable for our service, it's likely you'll be placed onto a waiting list. We do have priority for some groups. So we have priority for pregnant women, for new parents with children under 2, and for veterans if their mental health issue is linked to their time in service. But you will be advised on waiting times when you are at your assessment. If I can have the next slide, we've just got our opening times on there. So as you can see, we're open Monday to Friday, 8 till 8, so that we can see people before work and after work, and obviously at lunch times as well. And we are open weekends as well for treatment and assessment. So that's Saturdays 9 till 4 and Sundays 10 till 4:30. So if I can have the next slide, please. I just wanted to talk a little bit about some new groups that we've got starting this month. So we've got our Positive Steps group starting next week. The Positive Steps group is sort of teaching people self-help techniques to manage things like stress, low mood and anxiety. So that's starting next Thursday. We've also got our depression group and an anxiety and worry group, again, to teach you those strategies to manage your common mental health problems. Some other groups that we do have running sort of throughout the year address topics such as social anxiety, obsessive compulsive disorder, mindfulness, building low self-esteem and chronic pain as well. So if you know anyone suffering from any of those things who might need some support, it's the same referral process. They just need to give us a ring, or they can complete a referral online. And if they are suitable for one of those groups, they'll be offered that after assessment. Just go to the next slide, please. We've got a brand new group starting in a couple of weeks, which we haven't run before, which is in response to the pandemic at the minute. So the group's called Managing Distress During Challenging Times, and it's a 4-week group to normalise people's response to the pandemic and help them cope with how things are at the minute. Obviously, as things are starting to open up next week, we might find that people who have been experiencing some mental health problems, those might start to ease. However, we know that many people are still feeling really anxious about the pandemic and the uncertainty. So this group is aimed at those people, and it's aimed at people who haven't experienced significant mental health problems before the pandemic. Usually, obviously, people will come to us if they are suffering from a common mental health problem, but this group is specifically for people that haven't dealt with that before. So it's suitable for people who are feeling anxious about the pandemic, who might be feeling isolated and have stopped doing things. They might be feeling low in mood because they haven't been able to go out and see people. Even be feeling less confident now restrictions are lifting and are struggling to sort of get back to normal. So this 4-week group is going to provide coping strategies for these groups. So again, if you do know anyone who you think will be suitable, please do let them know. Again, same referral process. They just need to give us a ring or do an online referral, and if suitable, they'll be offered this group. I did mention our workshops before. These are available for people to book on directly. They don't need to have an assessment. You can just fill in a registration form and you'll be sent the links to these. All the dates are up on our website and we do post about them on social media as well. These workshops cover a range of different topics. We have a workshop brochure on our website which talks about some of the support we can offer, and these workshops can also be booked for groups as well, so for staff teams in Wakefield or for support groups in Wakefield. If it's booked for a group directly, as long as it's based in Wakefield, you don't need to have a Wakefield GP to access it. It's just for the public booking onto the workshops that we're looking for that Wakefield GP. If you can go to the next slide, I just wanted to mention our needle phobia workshop, which is starting in a couple of weeks, in response obviously to the great success rate that the vaccination programme is having. We are aware that some people may have a phobia of needles, and that might be one of the reasons why they are reluctant to get vaccinated. So we've developed a needle phobia workshop running for 90 minutes for anyone who might be a little bit worried about getting their vaccination due to that phobia. So to address that and hopefully overcome those issues. Again, if you're working with a group and you know there's a number of people that are suffering from this, then you're able to book this workshop as well. If you just give us a call or drop us an email, we can sort that out. If you go to the next slide, the last thing I just wanted to mention was that obviously it's Mental Health Awareness Week this week. So we've been trying to get out in Junction 32 on Monday, and we're going back on Saturday just to hand out leaflets and to be there for people who might want to ask questions about our support. The theme this year is nature, so I just wanted to mention some of the activities that we've been doing linked to nature throughout the last year, but also moving forwards. So last summer, sort of between the lockdowns, one of our therapists offered walking therapy, where he would meet clients at Nostell Priory and they do their therapy whilst walking around the space there, and that's something that we're looking to potentially restart this summer as well, with more therapists if they have that interest as well. Obviously being outside in nature, we all know the benefits of that for our mental health, but doing that whilst undergoing therapy was really beneficial for those clients. So we're just writing a report and reviewing that, but that's hopefully something we're going to be able to restart. We're in touch with Apple Tree Community Gardens about potentially using their space for some therapy, or perhaps to deliver some workshops, again being out in nature and the benefits of that. And similarly with the Hepworth, that they're looking to run some community programs in their gardens, and we'd love to be involved in that, and we're looking at potentially running some workshops alongside. So if any of you are working for organisations that might like to run something like that in partnership, that's something that you can obviously talk to us about. So on the next slide, I've just put our contact details if anyone does want to get in touch, or if they need to make a referral, then the information is there. Obviously I've mentioned our opening hours already, but all this information is on our website too. So the last slide is just if anyone's got any questions, I'm happy to answer them.
Or we give people a chance to think if they've got any questions. Just to mention that I've been on one of your workshops, Amy, and it was really good. It was informal but very informative, so it was a really good mix and I got a lot from it.
Glad to hear that. Thanks, Tracy.
Any questions for Amy before we move on? As always, you can email us if you want to email after. But so just to reiterate that we've got Mental Health Awareness Week. Neve, did you want to say something to this slide?
We've got social media going out all week if people want to share that on their channels with some helpful resources and assets.
Brilliant, thank you. And there are some links there to Every Mind Matters and the NHS, which are both really excellent sites. I think the next one is my bit actually. In addition to working on COVID Champions, I also facilitate a positive mental health network, which is a network of community groups and organisations that support people with positive mental health or support people with mental health challenges. And it's mental health in its widest sense. We do have regular newsletters, and they're now on our website, and there's a link at the bottom of that slide there to show you where the newsletters are. And the last week's newsletter featured the postcards from Wakefield project, so if you want to read more, there's information there. But basically we've had a load of postcards printed that depict Wakefield district. The picture is there on the slide, and we're encouraging people to write, draw, paint, whatever they'd like to do, a positive message on a postcard. It can be to yourself, to a neighbour, a friend, even to a stranger, people that you might even not know. It's just to try and reduce the stigma around mental health, to celebrate Mental Health Week. If you want to share information that's available to support people, you can do that on a postcard too. We've got lots of physical postcards that are available from Wakefield district libraries. Spectrum people have got a supply at the Apple Tree allotment, and you can also download one. There's a template that you can download. We're also linking it with creativity and nature. So if you want to create a little something, being mindful of the environment, you can leave it for people to find, you know, like the pebble projects that we had last year and the year before. Paint a pebble and hide it, and you can put some positive messages on there, whatever you like to do. So if you'd like to post a picture of your postcard when you've done it on social media, or post a message, we would really love you to share that with us on our Postcards from Wakefield Facebook page. So unless we've got any questions, that's all from us for this week. Thank you very much to everybody for attending. We really do appreciate you coming to these meetings, and we do hope that you'll find some snippets to take away and share with other people and support them too. Special thanks to Sam, Amy and Lisa for their presentations this time. If you do have any suggestions on subjects or presentations that you would like to see in the next few weeks, please do let us know, and we'll try our best to facilitate that if we can. So the message to end on is let's keep going. And I think Lisa, I don't know if I'm putting you on the spot here, might have got a positive little message to share with us all.
Not my wallpaper, but I'm going to be a grandma again, so that would be my positive little message. Was that what you meant, Tracy?
Yeah.
Yeah, I'm going to be a grandma again in October, so I swear life goes on and it's wonderful at times.
Absolutely. So congratulations, Lisa.
Thank you.
Thank you everybody for joining us, and see you next time.